So after you've evaluated the horizontal space of the edentulous site that you're looking to do a single tooth implant, the other critical factor that you want to evaluate is the vertical space that you have present. In this clinical scenario, you can see that while we seem to have adequate mesiodistal dimension for this site number 30, there seems to be an inadequate amount of vertical space present because of the presence of what we call ectopic migration or ectopic eruption. Essentially what this is where we haven't had an opposing tooth for a period of time. In this case, the opposing tooth has migrated down into the edentulous space, compromising the vertical dimension that we have for that future implant restoration. This is really critical when we're planning single tooth implants because it's not only about the available bone and space that we have for the implant to be placed, but it's also about the future restorative space that we have for the final restoration that that patient will be functioning with. If we look at a radiograph of the same clinical scenario, you can see radiographically the consequences or long-term sequelae of tooth loss in a segment of the arch. In this case, we can clearly see visually on the radiograph that tooth number 3 has ectopically down migrated into the edentulous space, and tooth number 31 has ectopically tipped as well as mesially migrated, compromising some of the space and dimensions that we have for this future implant site. So in this case, if we wanted to treatment plan this patient for a single tooth implant, we'd have to look at a couple different strategies to address this situation. One of them would be referral to an orthodontist for uprighting of tooth number 31 and intrusion of number 3 orthodontically, or we'd have to look at prosthetically correcting the occlusal plane issues on tooth number 3 with a reduction crown, and then plastiing number 31 to upright that tooth from a prosthetic standpoint. Each of these would have to be considered with the patient before treating the patient definitively.